Hello, this is Mary, and I'm going to be presenting my clinical teaching project plan. Let me get this set up. Okay, the clinical teaching project plan, educating Hispanic patients with diabetes. Excuse me, diet education that's relevant to culture. In the needs assessment, there were health disparities identified. The CDC mentions a higher incidence of diabetes in Hispanics than whites. And Hispanics are about 50% more likely to die from diabetes or liver disease than whites. Dietary modifications related to diabetes, while also considering cultural differences in food selection and preparation, are important elements when educating the Hispanic patient. As far as the needs assessment, we have a tendency to say, so what? Well, this clinic does not have a Spanish interpreter or a bilingual employee, and patients have an English-speaking family member to interpret who may have difficulty interpreting medical information. Providing information about diabetes that is specific to the Hispanic population creates a more patient-centered learning environment and increases self-management skills. I work at a federally qualified health center, which serves many uninsured Hispanic patients. There's a limited amount of information available to us in Spanish, which is not culturally relevant to the Hispanic population. Our clinic can better address this gap in education to help our diabetic Hispanic patients control their disease and prevent complications. In describing the learner, the age ranges from 33 to 59 years, all Caucasian, female, and English speaking. No bilingual employees were identified. Education level, there's one DNP, one MSN, one master's prepared physician's assistant, and two ADM prepared registered nurses. Technical skills, all staff have a background or training in nutrition and medical management of diabetes. Experience level ranges from 2 to 30 years experience in the medical field. And the cultural considerations include all clinical staff are Caucasian with a Southern American background. There may be a deficit in knowledge related to the Hispanic diet and cultural practices. Goals and objectives. The goal of this teaching project is to increase provider and staff knowledge regarding a diabetic diet that is culturally relevant to the Hispanic population. By the end of the learning session, 90% of the providers and clinical staff at Brunswick Health Clinic, which has been renamed, will be able to list three starchy foods that are common in the Hispanic diet and three healthier alternatives for the Hispanic diabetic. 2, describe 2 barriers to self-management related to diet for the Hispanic patient. And 3, identify 4 healthy methods of cooking traditional Hispanic food. As far as method of instruction, discussion was the chosen method. And the definition is from the Yale Poorvu Center for Teaching and Learning, which states, in quotes, discussion methods are a variety of forms for open-ended, collaborative exchange of ideas among a teacher and students, or among students for the purpose of furthering students' thinking, learning, problem-solving, understanding, or literary appreciation, end quote. A PowerPoint will be presented to introduce the topic, view the objectives of the class, present information related to the traditional Hispanic diet, and initiate each area of discussion. Case studies will be presented for each objective to encourage employees to discuss how they would handle each situation. And after the presentation, employees will be asked to discuss what they have learned from the class and how they will apply it when teaching Hispanic patients. Review the literature. In study 1, improving online teaching by using established best classroom teaching practices. This is a qualitative study, level 5. The method was a workshop which was held for faculty using Bain's 7 best classroom teaching practices. The faculty implemented these principles in their classrooms, and afterward, faculty and student focus groups evaluated the effectiveness of the workshop. The population was 11 faculty and 6 students in an RN to BSN program, and recommendations were made to improve online discussion, although discussion was mentioned as a valuable teaching method. Discussion in post-secondary classrooms, a review of literature, which is a level 5, and the method is a search of peer-reviewed journals located 50 articles with themes related to the effects of discussion in post-secondary education. The population was undergraduate and graduate students, which was nonspecific as far as what program they were in or their ages. Conclusion, the author felt there was no clear definition of discussion in the studies, as well as a lack of empirical evidence. The studies did suggest that faculty learn how to facilitate discussions and teach students the value of active participation in discussions. Study 3, learning by doing, an empirical study of active teaching techniques, which is a level 5. Faculty used lectures, demonstration, discussion, and in-class activity to teach various theories. 6 quizzes and 4 exams were administered to assess student learning and evaluate the effectiveness of each type of teaching methodology. The population was Midwestern University students, 18 men and 33 women. And the study concluded that while discussion can provide opportunities for critical thinking, it may also introduce incorrect information that students have difficulty disregarding. Further study was suggested. And in the final study, number 4, the effect of teaching based on dominant learning style on nursing students' academic achievement was quasi-experimental level 3. The method, students' preferred learning style, was obtained using Kolb's questionnaire. Pre and post test helped to determine success in the course. The population was 40 nursing students, 55% female, 45% male. And the study concluded that the dominant style was found to be divergent, and group discussion was utilized for teaching. The study found divergent to be the learning style for a majority of nursing students and recommends that teaching methodologies be based on students' preferred learning styles. Synopsis of the literature review. The trainings being provided for healthcare employees with a foundation in nutrition and diabetes management. Additional information was needed related to cultural differences to improve patient outcomes. And according to one of the studies, discussion is the preferred teaching method for nursing students. Study similarities. The studies were conducted at post-secondary sites, and the studies focused on discussion as a teaching method. Differences. One study utilized focus group for faculty and students. Another study was specific to online rather than face-to-face discussion. One study used pre and post tests to evaluate the effectiveness of discussion. And finally, one study recommended improvement in techniques related to the facilitation of discussions. Personal philosophy of education. Teaching should be interactive and supportive of students' goals. As an educator, the objective is to make learning fun so that students have an ongoing thirst for additional knowledge of nursing principles, leading to a desire to further their education. If educators are approachable and provide positive feedback to students on an individual basis, this goal can be achieved. Integrating the personal philosophy and the method of discussion. My chosen learning theory was constructivism during our concept map, which says students are encouraged to build upon their previous experiences and actively direct self-learning activities. This method aligns with the personal teaching philosophy by providing interaction while drawing on the student's previous experiences. The interaction during discussions can be perceived as fun, and the instructor can also observe and provide feedback as needed to encourage the discussion and offer further training if appropriate. The appropriateness for audience. Research has demonstrated that group discussion provides greater synthesis and retention of materials, quote unquote. All of the participants in the training have previous experience in the healthcare field, and some general education related to a diabetic diet. Excuse me. The background provides a solid foundation for discussion that focuses on cultural differences specific to the Hispanic population. And my thinking is that by synthesizing and integrating the previous experience and information they've learned with the new information specific to Hispanics, it will help them better retain the material. Outline of teaching content, objective 1, List 3 starchy foods that are common in the Hispanic diet and 3 healthy alternatives. The content includes a discussion of common starchy foods in the Hispanic diet and healthy foods that can be substituted. And again, we would use the PowerPoint and case studies. The PowerPoint would be presented to introduce the topic, view the objectives, present information related to the traditional diet for Hispanics, excuse me, and integrate each area of discussion, which would take about 20 minutes. Case studies will be presented for each objective to encourage employees to discuss how they would handle each situation, which I project to take about 15 minutes. And then after the presentation, employees will be asked to discuss what they've learned from the class and how they'll apply it when teaching Hispanic patients, again, which will take about 15 minutes, and then allow about 10 minutes for questions, which will be a total of 60 minutes. A further resource for the information regarding starchy foods for Objective 1 is listed below. Objective 2, describe 2 barriers to self-management related to diet for the Hispanic patient. Content, barriers to self-management and methods to overcoming them. The method and time was previously discussed on the other slide. And then again, we have resources listed there for Objective 2. Objective 3, identify 4 healthy methods of cooking traditional Hispanic food. Content, we would discuss healthy cooking methods specific to Hispanic food. And then the method and time, again, you'll see here if we discussed further earlier, and then resources for Objective 3 listed below. Evaluation of student learning. A pre and post test will be administered to evaluate employee knowledge prior to the class, and then knowledge gained after completing the class to get a good idea of how effective the objectives and teaching were as far as using the discussion method. The student will be able to list 3 healthier alternatives to the most common starchy foods in the Hispanic diet. The student will be able to describe 2 barriers to self-management of a diabetic diet for the Hispanic patient and methods to overcome them. And the student will correctly name 4 healthy methods of cooking a traditional Hispanic diet. The instructor will be evaluated on the following criteria. Was the instructor well prepared, knowledgeable about the subject? Were the objectives of the course met? Did the instructor encourage active participation in the discussion? And I think most importantly, did the instructor keep the discussion focused on the material? Was there an opportunity to ask questions? Were additional resources on the subject provided? And would you recommend this class to other coworkers? Here are my additional resources. And here are the references. Thank you very much for your time and attention, and I appreciate any feedback. Thank you so much.